Did you know that fungal infections affect over 1 billion people worldwide each year? Let's explore some truths about them. Before we proceed, please subscribe to this channel to receive more curated health videos. In this video, you'll learn a lot about fungal infections, including their names and symptoms. Fungal infections can be serious and often go undiagnosed, leading to complications that can be life-altering. It's crucial to understand why these infections are a growing concern, especially in this era of antibiotic resistance and compromised immune systems. Fungal infections can affect anyone, regardless of age or health status. They thrive in warm, moist environments, making some area of the human body ideal breeding grounds. If left untreated, these infections can cause irreparable damage to vital organs and even lead to fatalities. The alarming rise of fungal infections can be attributed to various factors, including the overuse of antibiotics, environmental changes, and shifts in human behavior. What's even more concerning is that fungal infections often masquerade as other conditions, making diagnosis a daunting task. It's essential to recognize the subtle signs and symptoms, rather than dismissing them as insignificant or attributing them to other causes. Fungal infections can spread rapidly, causing widespread damage to affected areas. It's vital to acknowledge the gravity of this situation and take proactive measures to prevent these infections from taking hold. By understanding the root causes and risk factors, we can empower ourselves to take control of our health and well-being. The lack of awareness surrounding fungal infections is staggering. Many of us are oblivious to the risks and consequences, leaving us vulnerable to these stealthy invaders. It's high time we shone a light on this often overlooked topic and took immediate action to protect ourselves and our loved ones. There are several types of fungal infections, each with its unique characteristics and modes of transmission. From athlete's foot to candidiasis, these infections can affect various parts of the body, including the skin, nails, and internal organs. Skin fungal infections. Tinea corporis, fungal infection of the body. Tinea cruris, also called jock itch because it is common in athletes. It is an itchy rash in the groin and inner thighs. Athlete's foot, Tinea pedis, is a fungal skin infection that usually begins between the toes. It commonly occurs in people whose feet have become very sweaty while confined within tight-fitting shoes. Tinea capitis is a fungal infection that results in patchy hair loss, scalp flakes and itching. Tinea versicolor is a fungal infection that affects the skin pigment, causing patches of lighter or darker color. Tinea nigra is a harmless skin infection that causes a dark patch on your hands, feet, or neck. It's caused by a fungus called Hordeia wernicki and can be treated with antifungal cream or scrubbing. Tinea barbae is a rare fungal infection that causes red, ring-shaped rashes in the beard and mustache area. Candidiasis is a fungal infection caused by an overgrowth of yeast in your body. Oral thrush, also called oral candidiasis, candidiasis, is a condition in which the fungus Candida albicans accumulates on the lining of your mouth. Candida is a normal organism in your mouth, but sometimes it can overgrow and cause symptoms. Oral thrush causes creamy white lesions, usually on your tongue or inner cheeks. Sometimes oral thrush may spread to the roof of your mouth, your gums or tonsils, or the back of your throat. Diaper candidiasis, also known as a yeast diaper rash, is a common condition that affects babies and others who sport diapers. It's caused by an overgrowth of yeast, specifically, Candida albicans, in the diaper region. Fungal nail infections. Onychomycosis, also known as tinea unguium, is a fungal infection of the nail plate, nail bed, or both. The nails typically are deformed and discolored white or yellow. Fungal pneumonia is a non-contagious lung infection caused by fungal spores. It happens when the spores mix with the air and are inhaled, or when an inactive infection is reactivated. Fungal pneumonia symptoms are those of the flu: coughing, headache, thick mucus, fever, and chest pain. Several fungi cause fungal pneumonia, the three most common ones being pneumocystis, cryptococcus, and aspergillus. These fungi are found in the air, soil, and clinical environments like hospitals. Fungal pneumonia tends to affect people with weaker immune systems, such as adults over the age of 65, children under the age of 2, and people with certain chronic diseases like human immunodeficiency virus, HIV, AIDS, or cancer. Coccidioides are native to the soil of the American Southwest, as well as parts of Central America and South America. Histoplasma fungi develop from the droppings of certain bird and bat species typically found in the central and eastern United States, especially in the Ohio and Mississippi River valleys. They also originate in Central America and South America, Africa, Asia, and Australia. Cryptococcus neoformans is found in soil and bird droppings in all parts of the world. Blastomyces live in rotting wood, leaves, and damp soil in the Midwestern, South Central, and Southeastern states. 7. Aspergillosis is a fungal infection of usually the lungs, caused by the genus Aspergillus, a common mold that is breathed in frequently from the air, but does not usually affect most people. Household mold. The impact of house mold includes 1. Damage to household items. 2. Health issues such as breathing problems, allergies, fatigue, body aches, and infections. 3. Mold produces allergens, irritants, and potentially toxic substances. Preventing and eliminating mold is crucial for quality housing conditions. Those with weakened immune systems, such as the elderly, young children, and people with chronic illnesses, are more susceptible to fungal infections. Understanding who is most at risk can help us take targeted precautions to prevent fungal infections from taking hold. Fungal spores are everywhere, from the soil to the air we breathe. These microorganisms can spread through contaminated surfaces, improper hygiene, and even person-to-person contact. It's crucial to recognize the common symptoms, such as itching, burning, and redness, which can be mistaken for other conditions like eczema or psoriasis. By being vigilant and proactive, we can catch these infections early, preventing further complications. Recent advancements in treatment have provided new hope for those affected by fungal infections. From topical creams to oral medications, there are various options available to combat these infections. Treatment course for fungal infections tends to take longer times than treatment of most common bacterial infections. For instance, it usually takes a month to treat tinea capitis, and only with oral medications. If there is evidence of mold in your home, remediation must be done by qualified personnel. Mold can cause chronic sinus allergies and severe asthma in some individuals. By adopting simple habits like washing hands regularly, drying skin thoroughly, and wearing clean clothes, we can significantly reduce the risk of infection. Moreover, research has revealed the importance of maintaining a balanced gut microbiome, which can help boost our immune system and fight off fungal infections. In conclusion, fungal infections range from innocuous superficial skin infections to severe systemic infections that can be deadly if not detected early and aggressively treated. By being aware of the fungal infections, we can empower ourselves to both prevent and to seek treatment when we contract them. Parting tip: whenever we take antibiotics to treat bacterial infections, we are at risk of developing fungal infections. We should take probiotics whenever we are on antibiotics to maintain or restore the microbial balance in our bodies. If you found this video helpful, be sure to check out our other content on health topics and share your thoughts in the comments below.